Hello, this is my speech, and this is my crowd, my audience here.
Hi.
Alrighty. Okay. So, excuse me, Harles. Alright, so, hello. I'm going to talk about how your oral health contributes to your systemic health and why your 6-month recall appointments are very important to go to. So many neglect to go to the dentist for their regular 6-month recalls due to fear, no insurance, or it's just not important to them. So going to the dentist for regular checkups can improve your systemic health, decrease the risk of oral diseases, and save you time and money in the long run. Oral infections such as periodontal disease affect the severity and pathogens of many systemic diseases. Perio disease can cause cardiovascular disease. It puts you at an increased risk of heart attacks and stroke. Inflammation occurs in gum diseases and is also what causes heart attacks and strokes. Inflammation makes it hard for blood to flow to your heart. Perio disease is what we worry about because it allows bacteria to go below the gum line. And your gums are full of blood, so if you disrupt them, bacteria can easily enter the bloodstream. Diabetes can also be affected by oral diseases. It can increase blood sugars and diabetic complications. Diabetic patients are more likely to develop perio disease than those without. And then those with uncontrolled diabetes are at an even higher increased risk because it is more difficult for these patients to control their blood sugars. Oral health can also affect your pregnancy and or the health of your baby. Premature births is thought to be related to perio disease. Mothers can pass the bacteria through kissing, sharing utensils, cleaning pacifiers with their mouth, or infants just putting their hands in their mouth. So now that you know how oral diseases can affect systemic health, it is also important to know how to eliminate these oral diseases. So ways that you can eliminate these diseases is going to the dentist every 6 months for your checkups. At these checkups, you receive oral cancer detections, cavity detections, plaque and calc removal, gum disease diagnosis. They can help you keep your bad habits in check and then find underlying problems using x-rays, head, neck, and lymph node checks. They can also give you referrals to other medical specialists. So if you had like pretty bad perio disease, they could refer you to a periodontitis. Checkup appointments are also great to receive oral hygiene instructions, such as like how to brush and floss properly. So a lot of people think that they know how to brush, but they really don't. So I have this little visual aid here. And we would sometimes use this for our patients if they needed it. So I guess I can show you guys how to brush your teeth. So we recommend putting the toothbrush at a 45-degree angle to the gum line and then doing circular motions like that so that you can kind of penetrate the gums. A lot of people just try to focus just on the teeth, but really you have to get up on the gum as well. So, yeah. Checkup appointments, we help you with your oral hygiene instructions. It's also a good time for like nutritional counseling. So if you are having like a bad perio, we can kind of help you out with your diet as well. So going to 6-month recalls can save you time and money as well because we kind of detect, for early detection of diseases and possibly even cancers. So we can detect like small interproximal decay early before it worsens. And then, so if you come in earlier than later, we can like seal up your teeth and stuff before they even have a chance to decay. Doing these things can save you time and prevent you from having to take time off of work for emergencies or even having to take kids out of school. Insurance covers 2 appointments a year, so there's really no reason not to go to your checkups. After understanding the oral cavity relating to systemic health, preventive measures, and saving time and money, we better understand why regular recall appointments are critical for maintaining your health. So, from everything I said, I hope you have a better understanding of why routine visits to the dentist are important, and how critical your oral health is to your systemic health. Maintaining these things will save you time and money, time and peace of mind in the long run. Identifying a problem when it is small can save you from a whole lot of other problems, such as receiving a fluoride treatment is a lot easier than drilling a hole in your tooth. So being proactive can save you in the end, so don't ever think that the dentist is not important. That's all I have. Do you guys have any questions?
Yeah. How often should you floss?
You should floss once a day, brush twice.